Hello everybody, this is Jonas, and I just want to show you for not too long an opportunity that I ran into just a few months ago. On Google or so, just like most of us. and uh, and so what it is, it's a virtual online research study for health insurance. And it's a 15 minute study that I was able to do, and it'll probably take you 10 minutes. It might take you 20 or so. But what's so special about this is that it's not too long, and I was able to make about $25, within that time period, and so that I spent doing the research after, a day or two, why don't we go there right now? So I wanted to show you. Okay, so it used to be Impact Health, now it's Joany, and so pretty much like most people have health insurance nowadays, if you got insurance through Healthcare.gov or through a health plan, and so we would like to participate on this research questionnaire, and what it does is helps the company, and pretty much they look for people who have health insurance that is currently active for 2017 right now. But before we get into the rest, I do want to emphasize these are some of the requirements, to qualify for research study, so you get paid. So first one is you have to buy insurance through your state exchange or healthcare.gov, through the Affordable Care Act, and so through your state, through a broker, directly through a health plan, and then you don't receive your health insurance through an employer. You currently have health insurance active at the moment, and you're not on Medicaid, Medicare, or VA health insurance. And lastly, you don't receive your health insurance through your school or university. So pretty much, if those things don't, if these things apply to you, like you have this, and then you don't have the couple of these right here, you pretty much should be set, and we're looking forward to helping you get an easy $25. So pretty much they'll review that, and then after about 48 hours, what they're going to do is they'll see if they need to get more information from you, or pretty much they'll probably most likely you might get one notification or so. But yeah, it's definitely well worth it, and then sooner after that, they should be able to pay you. And then they compensate you through PayPal or through Amazon gift card, so why don't we get started? So it's going to ask a few questions, such as pretty much your date of birth, and so and then your gender. Okay. All right. A yearly income. Now, no matter how much you make or how much less, it will not disqualify you as long as you meet the qualifications that I emphasized right at the beginning. These are just some questions to kind of get to know you that are required. So, I mean, just better to be honest, and employment status, um, and then your first and last name, your email address, uh, for phone number to reach you, and that is comes in handy in case they do need to follow up with you within a day or two, if there's some additional information they need, just in case. Usually they'll remind you if you forget, and then these are just questions like, so what apps do you use most, and then if you get your insurance through an employer, well, and some of the qualification questions right here. And so, have your, yeah. But yeah, like, so pretty much, I cover my own plan, get covered by myself, and these are just some questions. Of course, that just get some feedback for you. The whole purpose of this is to kind of just see what the demographics of certain people, what they think about health insurance and so on, their coverage, and so pretty much. Yeah, so these are just some questions, or so not so difficult, mostly multiple choice. It kind of like you know comparing a multiple choice test and essay question test. Um, yeah, these are just a few questions, and so they don't seem that hard, and so on. I mean, but most importantly, I guess it's for the best interest to be honest, and so and that just helps everybody out. So definitely. So I know this is easy money, but of course, definitely. And even if you're lying, they still are going to verify if everything's correct, and so eventually. Um, but yeah, I wouldn't stress too much about it. Definitely. Um, and these are not so hard questions, and so and like so yeah, it does not ask for your social security number, but you will have to take a picture of your health insurance card or so, showing the coverage dates or so if it's on there. Or what you can probably do is go onto your health insurance, website, log in, and try to show that you have coverage with the date, and then maybe like just see this like date and time over here. Take a picture, like a screenshot of it, and that way, so you can show them and with the policy number, and that way that like that'll prove to them that you currently have coverage, and that'll fulfill the requirements, because that's one of the like common ones that people get is they don't have the coverage date showing. So now you know the drill. So yeah, but definitely keep in mind those requirements that we went over, and so definitely like again, you brought insurance through a state exchange or Healthcare.gov or through a broker, any one of these. You currently have health insurance active. Those are just those things that the requirements that do need to be met. And of course, the don'ts is you don't receive health insurance through an employer, you don't have Medicaid, Medicare, or Veterans Affairs health insurance, and you don't receive health insurance through school or university. So, I mean, if these things apply to you, then I definitely encourage you to do this survey. And of course, I make $25, and so do you, of course. So we all win in this game. So yeah, and of course, I want to just show you right here. So I know there's going to be some people thinking if this is kind of like if this is the real deal, and so okay. So yeah, this is just some reviews people have had, and about doing it. So I did this research before actually doing the survey, and they're not going to ask for any payments like that you need to make. So this is sure not a scam at all, for sure. And I can kind of go show you another one right here. Um, yeah, so definitely. But yeah, I know that I have done the like research, and I got paid within a few days, and I told my friends about it, and they had the same experiences. So definitely. And but yeah, thanks to everybody, and thanks for watching, and good luck with everything. And so